the truth will not be silenced, the show that allows people to be seen, to be heard, and to be human. I'm your host, Melissa Woodfork White. In today's episode, we will talk about medical billing and coding fundamentals with Shirley Crews. Sharing our stories allows us to encourage, inspire, motivate, uplift, and help people. There will be a special surprise at the end of the show. Be sure to listen all the way through for the details. Our special guest today is Shirley Crews. She began her journey as a young medical assistant. She furthered her education and attended the University of California, Los Angeles, known as UCLA, when she became a medical biller and coder through their medical office management program. Shirley also became a licensed X-ray technician in the state of California. She has 2 bachelor degrees, one in healthcare administration from the University of Arizona and a second in biblical studies theology. Shirley is nationally certified in the following areas: medical billing and coding, electronic medical records, and medical administrative assistant. She is also a BLS Basic Life CPR instructor through the American Heart Association. She is passionate about sharing her education and experience. Shirley is going to share with us about medical billing and coding fundamentals. Hi, Shirley. Welcome to the show. Thank you so much for joining us.
Thank you, Melissa, for having me. I'm so excited to be a part of your podcast. Thank you.
Thank you. We're going to go ahead and jump right into that first question. What is medical billing and coding?
Well, medical billing and coding has 2 parts. A medical biller submits insurance claim forms to the insurance provider. They also verify patients' insurances. A medical coder reads operational reports, mainly from the hospitals, and then they abstract, meaning pull from, the patient's diagnosis as well as the procedures that the doctors has performed on the patients. Now, there are 4 coding books and 4 coding types of codes. The first I would like to talk about the ICD-10 codes. CM. There's ICD-10 CM and ICD-10 PCS. The ICD-10 CM, meaning clinical modification, are codes for strictly diagnosis. These codes are published through the World Health Organization, and they are globally codes for diagnosis, such as cancer, diabetes, AIDS, things of that sort. Your other coding is procedure codes. These are formerly known as, and currently known as current procedure terminology. Now, these codes are strictly utilized by our providers, meaning doctors within the United States. These are for your procedures, like when you go to a doctor's office and you have an x-ray, or they draw your blood, or they give you an injection. These are strictly procedure codes, and these are utilized standard throughout the United States. Then, of course, you have your HCPCS codes. These codes are strictly for, don't think of like procedures or diagnosis, think of like equipment, like wheelchairs, crutches, ambulance, transportation to a hospital through a helicopter. So again, these are equipment codes, better known as DME, durable medical equipment. And then, of course, you have your ICD-10 PCS codes. Now, again, these are through Medicare. These are published by Medicare, and these are strictly codes that, again, are utilized only by doctors in the United States. And these are like when patients go into the hospital and they have like major heart procedures. So these are procedure codes. So keep in mind, you have outpatient procedure codes known as the CPT codes. You have inpatient codes known as your ICD-10, PCS codes, and then also you have equipment codes, and also you have diagnosis codes. So I would like to share that. Now, again, so far as most of the schools, of course, they have
I'm going to
both.
stop you right there. We're going to stay on the
Okay,
first question, and then we'll get into
excellent.
that next question in just
I
a
have a
moment.
plan. Thank
So
you.
no worries. So just to recap, medical billing and coding is the process of identifying diagnosis, medical tests, treatments, and procedures found in clinical documentation. And then what you actually do is you transcribe this patient data into standardized codes to build government and commercial payers for physician reimbursement. And that's from the AAPC. So that's where you were sharing with us about the different coding and how they get reimbursed. Physicians get reimbursed. You also told us about the steps or the process to medical billing, meaning that you have to verify insurance coverage. You also do pre-authorizations and referrals. You correct statements and payments. You set up payment plans and collect on past due accounts. You appeal denied insurance claims. And you have to be knowledgeable. I think you mentioned this in HMO, PPO, Medicare, and Medicaid coverage. And that's from the Nurse's Journal. So with that being said, how important is medical billing and coding to the actual patient?
Well, for the patients, they usually send out what is called a EOB, better known as an explanation of benefits.
Mm-hmm.
So they also send this to the providers too, on how the provider was paid. Mm-hmm. And to the patient too, they can track too, like their co-payments and what was paid through their insurance companies.
And that would include deductibles in addition to co-payments,
yes, and co-payments,
depending on what kind of health insurance, medical insurance that they do have. And so, and it also lets them know that if they owe anything or if there's no additional costs. And so I like the explanation of benefits because that helps me to understand your medical coding and what I was seen for when I go to the doctor. And so from a patient perspective, just my experience, it's important because then it lets me know what exactly I got when I was in the doctor's office. Now, I wanted to ask you this coming from the profession. Are you the people that we see at the front office when we check into the doctor's office?
Great question. There's a yes and there's a no.
Okay.
There's a yes.
Or do we see you on the way out?
Both. It depends on how your provider's office is set up.
Okay.
Now, some providers do use their code and billers to be at the front desk because they are experiencing collecting the patient's medical insurance cards and, of course, verifying insurances. And they can know, too, what to collect from the patient, such as deductibles and or co-payments. Mm-hmm. And co-payments, of course, is a certain amount that the patient must pay at every single visit. A deductible is something just like if you have car insurance, you pay first and then they will pay, the insurance company will pay. So yes and no, depending on your provider's office.
Okay. And the reason why I asked that question is because at my provider's office, I think that that's the medical billing and coder up front, because if they have to take a co-payment or a deductible, they do that before you go in to see the doctor. And then depending on at my OBGYN, they do it at the end. So that gives them time to process the insurance and then to see whether or not you have to make a co-payment or a deductible on your before you leave. So that's why I had asked you that question from the patient perspective.
Yes, and I want to iterate, like I said, there's a yes and a no, because they also train the medical assistants or the front office patient too, personnel to also collect the code payments and to verify insurance as well. Because a biller sometimes is literally in the back and they are going to bill the insurance companies. So it depends again on how your provider's office is set up.
Well, that leads me to the next question, Shirley. So is a medical biller and coding also a medical assistant and vice versa, or are they two separate positions intertwined? Can you explain that to us?
There's lots of different positions in the doctor's office. A medical biller and coder basically go to school, and they are trained to both bill insurance companies as well
Before we
as
get into
read.
that question, Shirley,
Okay.
is a medical biller and coding also a medical assistant and vice versa? Or are they
Not
two separate
necessarily.
things?
Two separate. A medical
Okay.
assistant usually do clinical skills.
Okay.
So those are the people that are taking you in the office, asking you your chief complaint, and also doing your vital signs and assist the doctors with injections or operations. Medical billing code is strictly are trained to, like I said, read medical reports and bill insurance companies.
All right. And the reason why I had asked you that question is because you said that some medical assistants may be medical billing encoders. Is that correct?
Not necessarily.
Okay.
They may be front office
Got you.
personnel. They may be at the front desk, but the medical billers
Mhm.
are strictly in the back office, and they're literally billing the insurance companies. The
Okay.
medical billers, the medical assistants are the people that are up front just collecting co-payments and verifying the insurances. So
Thank
that's
you
why I
for that
said it can be
clarification.
interchangeable. Yes.
Yeah, that's very helpful. I'm learning. I'm learning. So this leads us to our next question, Shirley. What are the fundamental steps to getting certified in medical building and coding?
First of all, you want to go to a school. Most
Before
medical
we get
billers.
to that, the requirements.
Yes, that's what I'm going to tell you though. You
Okay.
have to go to school first, to either vocational college or community college
Well, don't you
first.
have to have your high school diploma or GED
Have a high
first
school
before you do
diploma,
that?
yes,
Yes, that's
GED,
what we want
that's
to start.
standard. That's standard. That's standard. Okay. There was a year ago, there were some schools that were offering you to come and do dual programs.
Mm-hmm.
One of the schools I worked at, they were having students do dual programs. I mean, take a program as a medical bill or a medical assistant while they was also getting the GED.
Wow. So go ahead. Take us from getting your high school diploma to your GED and then enrolling in a program. Take us through the different associates, bachelors, um, steps, process.
There's different there's different steps to take. One is your short-term programs. Of course, those are through the vocational career colleges.
Mm-hmm.
Those programs are usually anywhere from 5 months to 9 months.
Mm-hmm.
Now, then you can go to the community level, the community college, and go. Their programs are usually like a year to 2 years.
Mm-hmm.
But then you can go to like a university and just get your bachelor's degree, and that's what I started off. I started off with UCLA, which was a 1 year program
Mm-hmm.
as a medical. So it doesn't matter if you go to a vocational college, a community college, you are going to be a medical biller.
Mm-hmm.
And then of course it's up to you if you want to further your education by getting an associate degree or a bachelor's degree. But a medical biller is a medical biller. And
So
then,
it's a certification that you can
well,
also
there
get
is
a
a
degree for.
certification. I'm getting to that.
Okay.
Certification is not necessarily a requirement. I'm going to give you
Okay.
an example. Just like doctors, when they all graduate from medical college, they all are physicians. However, some continue on with their education and become specialists, like a pediatrician, dermatologist, neurologist. So again, but when they first graduate, they all are medical doctors. The same thing with the medical biller and coder. Whether you go to a vocational college or community college, you are going to be established as a medical biller and coder, and you will receive a diploma. There's up to you if you want to challenge yourself and take one of the national exams, such as the AAPC or the HEMA or the NHA. So there's about 4 to 5 different organizations that you can become nationally certified.
Okay. So for those of us that are not in the medical billing and coding, just for clarification, it's not a certification, it is a diploma?
Yes.
Okay. Because when you
well,
see
it can be a
the reason why I was
not,
asking that question, Shirley, is because when you see a lot of the advertisements, they say certification. And then when I did my research about it, it was saying associate's degree, bachelor's degree. So that's why I'm asking you, as someone who's not in that field.
Okay, now it can be labeled as diploma or certification, but again, there's a difference between certification and nationally certification. So it depends on your school that you go to. They can call it diploma or they can call it a certification. But if you take one of the, challenge yourself and take one of the nationally certification, then you are not just your regular standard medical biller, you are nationally certified. That's the difference.
Okay, thank you for clearing that up. Because like I was saying, not my field, but as a consumer, you see all the commercials. And then as the podcast host, I do my research and then I'm like, okay, is it certification? Is it diploma? So basically it's tomato, tomato, potato, potato, depending on where you go. Is that right?
Right.
All
so
right.
Yes, so just to clear it up one more time, certification versus national certification. Certification just at your school level, nationally certification through one of the nationally certifying board organizations.
Understood. Thank you for clarifying that. Can you tell us about the certification exams that one would have to take and then the steps to gaining employment after you have been certified or receive your diploma for medical billing and coding?
Well, it's up to you. Remember, there's like 4 to 5 different organizations. You have to do your research.
The exams. Tell us about the certification exams. How many?
That's what I'm talking
about. Okay. Okay.
There's the AAPC. Those are mainly for if you want to work outpatient clinic. There's the HEMA. That's if you want to be a coder in the hospital. There's the NHA, which is recognizable as well as a biller and a coder. So you got to keep in mind, there's coding strictly certifications, and those are strictly through the AAPC and the HEMA. And then there are billing and coding certifications. So that means you are certified in both. As a coder and a biller, those are through your NHA and also your NCCT.
So once again,
the AAPC, and the HEMA strictly coding. Those are people that usually just working in the hospitals, and all they're doing, they're not doing billing. They're only reading operational reports, and they are abstracting, meaning pulling the diagnosis from the doctor's operational reports and transferring them into codes. The billers and coders, they're learned to do both billing and coding.
Understood. So there are, depending on what type of certification you go for, determines what type of certification exams that you need to take to become certified.
Yes.
Gotcha.
And that would make you like a specialist. Like I go back to say, the doctors, when they all graduate, they're all doctors, but then you have your specialists. So that means there'll be a specialist.
Understood. In that field. So based on your experience, what would you recommend those that are entering the field to take?
Well, in my experience, depending, like I said, whatever you are going to school for, do you want to be a biller and a coder? Or would you like to be a just strictly coder. I'm a biller and a coder. So I can read the reports and I can bill because that's what my certifications are in. But if you strictly want to work in a hospital, then of course, then you'll go for like the AHIMA or the AAPC. That's strictly coding.
So I understand that that's the advice that you would give someone based off of what they were choosing to do. But
right.
My question is, what would you recommend? Do you recommend being a medical biller and coder because you are a medical biller and coder? It's more of a personal, professional question. Your preference.
I recommend, well, basically, okay, good question. Most of the schools anyway, most, not all, but most of the schools anyway are offering you to be both billing, a biller, and a coder.
Okay.
But then once you leave the school, it's up to you to decide which path you would like to take. My recommendation is you have to, be open to what you personally would like to do. Like I said, my personal experience, I became a biller and a coder.
Understood. Thank you for sharing that with us, Shirley. So with that being said, can you share with us I know it's been a while. Can you tell us how long you've been in medical billing and coding?
A long time.
Are we talking
20 years?
Okay, that's what I was saying. So over 20 years experience, professional experience in medical billing and coding.
Yes.
So can you share with us your own experience when you actually were taking the exams that you actually took? Give us some insight into those exams that you actually took because you did both medical billing and coding, just to give us a glimpse, and then your experience with doing that whole process.
Well, my experience, the reason I became certified because I also teach medical billing and coding. So I'm not just working out in the field. I did that first, and then I've been teaching for over 10 years. So that's why I became certified, because most of the colleges that you teach at, they want you not only, I went to school for it, but worked out in the field and become certified. Mm-hmm. So that's why I personally, because I was a medical biller and coder before I became certified. So most students, when they graduate from school, again, they're going to work in doctor's offices. So they're going to go out externship. They do have externships. Okay. And then they're going to go out and work in the offices from 2 to 3 months as an externship person now, depending on what school you go to. And then I suggest, remember, you used to ask me my recommendation. If you're going to take any one of these certifying exams, you should at least work out in the field first so you can have a little bit more knowledge, because a lot of the questions on these exams are based on not just theory, but also practical.
Understood. So you would recommend that they actually get some experience in the field,
yes,
so that they can relate to the actual exams that they're actually taking, putting practice,
yes,
practice into play. Yeah, that's exactly what I was thinking, putting practice into play. So can you tell us, if you can recall, when you took your exams, how was it for you?
You have to really study.
So it's a lot of studying. And the reason why I'm asking you this, because I don't want people to think, oh, I can just go do X amount of hours, X amount of time and become a medical biller or coder. I really want you to share your experience of the process, that what you went through. And by you letting people know, it's a lot of studying. It's a lot of studying. It's a lot of studying. That's very helpful.
And I want to also tell you guys too that all the certifications organizations have study guides. They have practice questions. So I suggest that whatever organization you decide to take your certification with, you get their study guide. But again, it's not just study guide, because you have to have, a lot of these places give you critical thinking too. Mm-hmm. So that's why I said if you work out in the field first, you'll have more work-related experience. So get the study guides, get the practice tests, but read through, practice, work out in the field. You have to get serious with these organizations, because they are definitely designed to make you really think. That's my experience. And I was a proctor for the NHA, the National Healthcare Association.
Nice.
And I did help put the national exam together.
Wonderful. Wonderful. So has it changed much since you took your exam to the way the exams are given today?
Probably not, because medical billing is medical billing. And it's like this, right? You just have to literally know how to code. Don't have to remember codes. They don't want us to remember codes. There's thousands of codes. So you just have to know how to correctly code. And you just have to know questions on, like we started at the beginning, how to verify insurances, different types of insurances, know the difference in the coding, like such as the ICD-10 codes, the CPT codes, the different organizations that publish these books. So, yes.
All right. So Shirley, tell us, how does sharing your story today help others? Share the work that you have done or doing to bring about change. Tell us about your current and future plans.
Well, I've taught in many states, well, I'll say 3 states, but I taught thousands of students because remember, I've been teaching for 20 years. Okay. So I taught in California, state of California, I taught in the state of Nevada, and now I'm teaching in the state of Phoenix. So I have taught many, many students. I have shared my experience, and I know I have changed many, many lives. And I currently am still teaching. And I am currently seeking more information. I think I'm a professional student because I'm currently now.
We call us, in my profession, we call us lifelong learners.
Like you. Like you.
Like you. Shirley, thank you so much for joining us today and sharing with us about medical billing and coding fundamentals and giving us that insight into it, into your profession, and also sharing your experience within your profession. We really appreciate that. Thank you so much.
I appreciate you having me. Thank you so much for inviting me. And I hope that I have shared some information that will enlighten some young men and women, old men and women, to go out and get a career. And you may say that you're too old, too young. No, I have taught students from the age of 17 to 80. So there's an opportunity. And keep in mind too. Keep in mind too.
It's never too late.
Yeah, it's not just a job. It is a career.
Yes. Well, thank you so much, Shirley. Yes. Next week, we'll continue to discuss and have conversations about real experiences, personal and professional. Stories that need to be shared, seen, and heard that makes us human. The truth will not be silenced. To be seen, to be heard, and to be human. The surprise, if you like or leave a positive comment about the show, you will get a shout out. This includes businesses, products, services, organizations, and events. Following the link in the show notes lets Buzzsprout know we sent you and help support our show. Buzzsprout is the best way to launch a professional podcast. Want to ask a question, be a guest, or subscribe to this podcast, The Truth Will Not Be Silenced? Click on the show link. Thank you so much for joining us.